This is going to be an interesting and fun day today. So we're doing a procedure on our patient Ricky here, who's been with us for some time. We've done a few procedures on him, and overall we've had a very nice response with his results. Mainly working in the front. He really didn't have a whole lot of hair, and we were able to create something that was, at least for him, very manageable. And now we're at a point where we're trying to get some more coverage back into his crown. The back of his head is at a point where it's good, but we really can't harvest much more out of there. His donor really is not donor that is reasonable to consider going in and doing another strip. He's not a great candidate for follicular unit extraction in the back because his hair is soft and fine, and it really isn't going to produce what we're looking for. And we're really looking to get just some coverage into his crown, because that's kind of a little trouble spot for him.
I just wanted to do more improvement. I do want to push the envelope and see what we can do to, make me to look better. I'm always, keeping my body in shape, so I feel the same thing from a facial perspective and hair perspective. I was looking to really make it really where I wanted to be, so that's really why I'm here today.
We've came to the conclusion that doing a beard hair transplant would work very well for him. He's got very strong hair through his beard. And the thing you want to be a little bit, cautious of is you don't want to create any type of scarring on the face. But he's not really prone to that because he's very light-skinned and fair-eyed, and so that risk is very negligible. And I think that he'll do very well. We should be able to harvest a reasonable number of grafts from the beard area and then transplant him into his crown and come out with a pretty nice result. Here we are with Ricky. We're done. And I'm actually really impressed because you really can't see a whole lot. We got about 600 grafts out of the beard. We used a small 0.9 millimeter punch, and he really slept through most of it, didn't have any problem at all. And that was enough for us to get some pretty decent coverage into his crown. And I don't think he's going to have any issue with healing whatsoever. So he looks really good right now. We're going to give him some antibiotic ointment and some medicine to use to keep the swelling down, but I'm very pleased. I think this is going to come out awesome.